What FSH levels indicate menopause diagnosis? Imagine trying to understand your body's signals as you go through changes in your life. One key hormone that doctors look at is follicle-stimulating hormone, or FSH. This hormone is produced by the pituitary gland and helps control your menstrual cycle by stimulating your ovaries. During your reproductive years, FSH levels stay within a certain range, usually between 4.7 and 21.5 milli-international units per milliliter. As you approach menopause, your body starts to change, and FSH levels begin to rise. This is because your ovaries become less responsive to FSH, and your body tries to compensate by producing more of it. During the transition phase called perimenopause, FSH levels can fluctuate widely from day to day. When you finally reach menopause, which is officially diagnosed after 12 months without a period, FSH levels tend to stay high. Typically, doctors consider an FSH level above about 30 milli-international units per milliliter as a sign that menopause has begun. But it is not just about one test. Because FSH can vary, especially during perimenopause, doctors usually recommend multiple tests over a few months. When FSH levels stay above 30 milli-international units per milliliter for at least 2 months, along with the absence of periods for a year, that confirms menopause. Postmenopausal women often have FSH levels that can range from around 25.8 up to 134.8 milli-international units per milliliter. Elevated FSH levels reflected the body's effort to stimulate ovaries that are no longer responding. Symptoms like hot flashes, night sweats, vaginal dryness, mood swings, and irregular periods often accompany menopause. Still, doctors usually relying on the absence of periods for 12 months and these symptoms rather than just hormone levels alone. It is also important to note that hormone therapy or certain medications can affect FSH test results. Sometimes, doctors will also check other hormones like estradiol, luteinizing hormone, or anti-Mullerian hormone to get a clearer picture of ovarian function. If you're noticing irregular periods or symptoms of menopause, talking to your healthcare provider about FSH testing can help you understand where you are in your menopause journey. Remember, FSH levels tend to rise gradually over several years before your final period, so testing can sometimes help identify perimenopause. But for a reliable diagnosis, it is best to look at hormone levels together with your menstrual history and symptoms. In summary, when FSH levels stay above about 30 milli-international units per milliliter for at least 2 months, and you have not had a period for 12 months, it usually indicates menopause. This information can help you and your healthcare provider plan the next steps for managing symptoms and maintaining your health.